Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you are all fine and doing well for your upcoming nursing competitive exams. In our YouTube channel, we are posting important topic as well as important MCQ for the upcoming nursing competitive exams. So please kindly subscribe our channel so that you will get to know about the topics and the questions as well as the upcoming exams related videos also. Okay, we'll enter into the topic. Before that, we will see small quote about the today's thing. Even the hardest subjects can be understood when you put in the effort. மிகவும் கடினமான ஒரு சப்ஜெக்டும் கூட உங்களால எப்படி அண்டர்ஸ்டாண்ட் பண்ண முடியும்னா உங்களோட எஃபர்ட்டை போடும்போது ஓகேவா. ஸோ இஃப் யூ புட் அஸ் எஃபர்ட், ஈவன் த டஃபஸ்ட் சப்ஜெக்ட்ஸ் வாட் எவர் யூஆர் ஃபீலிங் about in the nursing any topics, if you put your full effort, definitely that become easy. Okay, we'll start with the today we are going to see about epilepsy, epilepsy related MCQs. Do you think epilepsy, seizure, convulsion, everything is same? No, some difference are there. Okay, first, what is seizure? Seizure is an abnormal, sudden, excessive discharge of electrical activity in the brain. Okay, abnormal, sudden, excessive discharge of electrical activity in the brain. What is meant by epilepsy? If the patient is having epilepsy, that person will have the repeated seizure. That abnormal electrical activity, if it is repeating, it is called epilepsy. If it is comes once it is seizure. If it is repeating, it is epilepsy. Clear? What is meant by convulsion? Convulsion nothing but it describes the involuntary action or jerking and contractions in the body. That is called convulsion. So now you know the difference. What is seizure? What is epilepsy? What is convulsion? Okay. What is status epilepticus? If a seizure that lasts longer than 5 minutes or having more than one seizure within 5 minutes, that is called status epilepticus. In that time, the patient with or without come to the normal consciousness. Mostly without returning to the normal consciousness. Some patients rarely will come back to the normal. Okay. So some network interruptions. Okay. So the question is about, they're asking the type of seizure. So the question regarding that, when there is a restricted to the particular part of the cerebral cortex. So it is called partial seizure. The correct answer is partial seizure. Okay. So the other name for the partial seizure is focal seizure. If you consider the whole brain, in any part of the brain, either it's a parietal or a temporal, wherever the area, if it is in the only one particular area, the seizure activity is happening, it is called partial or focal seizure. Complete means entire brain is getting involved. The general is also same terminology. The other name for the complete is generalized. Okay. So that is the correct option is a partial seizure. It's only the particular part of the brain getting the seizure activity. Next question. Which seizure type is most often associated with structural abnormalities of the brain? If any abnormalities in the structure of the brain, what type of the seizure the patient will get? The options: focal or partial, generalized, Lennox-Gastaut, status epilepticus. So the correct option is focal or partial seizure. What is structural abnormalities? When the patient is having a stroke or a brain tumor or any brain injuries, there is a structural abnormality will happen in the brain. So those patients will have focal or partial type of seizures. Okay. generally is not related to the structural abnormalities. Okay. What is Lennox-Gastaut? Please comment about Lennox-Gastaut. Whoever knows about it, please type it in the comment box. What is meant by Lennox-Gastaut? Okay. Status epilepticus already we have discussed. So according to this question, the correct answer is focal partial seizure associated with the structural abnormalities of the brain. Next, this type of seizure, also called petit mal, is a brief episode of staring with impairment of awareness and responsiveness. Options: myoclonic seizure, absence seizure, infantile spasm, tonic-clonic seizure. Various types are there. The question is asking about petit mal. So there is a brief episode of staring with impairment of awareness and responsiveness. So the correct option is absence seizure. These type of seizure we can see it in the children's. Mostly the children's we can see the absence seizure. Patient may be sitting simply and seeing some objects continuously, staring at one place. Okay, and brief there is a impairment of awareness will be there. Okay, that is called absence seizure. Next, which of the following is a treatment for epilepsy? Ketogenic diet, anti-epileptic medications, vagus nerve stimulator, all of the above. So the correct answer is all of the above. The patient who is having epilepsy, they have to follow the ketogenic diet. The studies given the result that patient who is taking a low carbohydrate and a high fat diet, the patient will have the seizure stimulation will be less. Some research are going on. Next, anti-epileptic medication, yes, definitive treatment. Vagus nerve stimulator. A small device will be fixed in the surgically implanted in the brain so that whenever the abnormal activity will be there, this stimulator will control those activities. That is vagus nerve stimulator. So these are the treatment for the epilepsy. Next, epileptic seizure occurs due to electrical misfiring in the which area of the brain? Brain cortex, medulla oblongata, brainstem, spinal cord. The correct option is brain cortex. Yes, the entire brain is called cortex, right? Cerebral cortex. So when there is an abnormal electrical activity in the cerebral cortex, it is called epileptic seizure, right? Yes. Thank you all. That's all about today's session. If you have any doubt, you can message it in the comment box. Okay. We'll see it in the next class. All the best. Thank you.